So how's everything? How's everybody doing?
Good.
Welcome to another session of anatomy today. In this session, I'm going to be concentrating on human skeleton, joints, types of joints, properties and function of joints, and movements. It's very important for us to understand our body, and our body is made up of bones, joints, muscles, as you all know it. So just going with the human skeleton first, wanted to also stress on osteology. Osteology is our, Osteology is a science of bones. It's a study of bones. In osteology, we're going to study the whole skeleton system. So in order to study the skeleton system, it's very important that we can actually name the bones of our skeleton. So I'm going to explain you all the bones, the names of the bones. So let's go back to this slide. The human skeleton is comprised of 206 bones. In total, there are 206 bones. To name the bones, let's start with the skeleton here. So as you may see, this is the skull. The skull is composed of cranium and the facial bones. Coming down to the next section, there is this spine. The spine have all the vertebrae. There are about 26 vertebrae. This is the clavicle. It's also called as the collarbone. So you may also know in females this is a very nice bone. It's also called as a beauty bone. Coming to the back here, this is our shoulder, and in the shoulder this is the scapula. This is our shoulder joint. So we'll study about the joints after. I'm just going to explain you all the bones first. Coming to the front, the chest section, this is the middle portion. This is called the sternum. Around that is our rib cage. So these are the ribs. There's about 24 ribs. And then coming down to our limbs. Limbs, this is the long bone. This is called the humerus. This is called the radius. This is the ulna. You can actually stop me if I'm going too fast, let me know. And I can repeat myself, no worries. So these are the carpals, the metacarpals, and the phalanges. So this is our upper limb. Coming down to our pelvic region, the pelvic region is also called as the hip bone. This is the ilium, if you can look here as well, ilium. That's the sacrum, and that's the pubis. Okay, that's the pubis right there. So this is the most, when we come to the joints, you will also learn that this is the immovable joint. Coming down to our lower limbs, this is the femur. This is the tibia, the fibula, and then in the foot, there's tarsals, metatarsal, and phalanges. So in total, this is our human skeleton. Any questions there?
No.
Okay, let's go on to the, in the human skeleton, I also wanted to explain you, let's go back to the next slide. So as I told you, there's 206 bones. The human skeleton is divided into two parts. There's the axial part, and then there is the appendicular part. The axial skeleton consists of, out of 206 bones, there's about 80 bones that forms the axis of the human skeleton. The axial skeleton will consist of our skull, which is the cranium and the face. It also consists of our hyoid bone. It consists of the auditory ossicles, which is our ear bones. And then it consists of our vertebra and thoracic region. So in total, there's about 80 bones. So as you may see here, the auditory ossicles are 6, the hyoid bone is 1, the vertebral column is 26, and the thoracic cage is ribs 24, and then the sternum is 1. So altogether, 80 axial the bones in the axial skeleton. The next is we're going to study about the appendicular skeleton. The appendicular skeleton is actually our shoulder girdle, the upper limbs, the pelvic girdle, and the lower limbs. So altogether, there's about 126 bones that comprise our appendicular skeleton. Another thing I forgot to mention is very important. What is the function of these bones? Or what is the function of the skeleton system? Very important. Skeleton system actually supports our body. It provides the shape, the structure to our human body. So whether tiny people, tall people, you know, all that is based on the shape, the structure of the bone. Another important function of the bones or human skeleton is it protects all the systems and our internal organs. Very important. It acts as a viscera or a cage, you can say, for our internal organs. Another important function of the human skeleton system is it provides the attachment to the muscles. Very important. Bone is also actually called as an organ because of all these functions that it has or the importance in our life to form our whole human skeleton. It also is a very big reservoir of, or a storehouse, you can say, for minerals, for our bone marrow, all the salts. So you may also notice is as someone ages, you know, there's calcium in our bones that gets excreted out. They lose calcium, so they can suffer from osteoporosis and things like that. So very important. It's highly mineralized and a very good vascular system. So next, so as I already told you, bone is also called as an organ. It is the hardest structure of our body. It is very vascular, mineralized, connective tissue. Bone is actually divided into two parts, organic and inorganic. So organic is actually the 1/3 part, and it comprises of collagen fibers. What it does is it provides resiliency to our bones. The inorganic part is about 2/3, which is calcium, you know, all other salts of the body. It provides the rigidity to our skeleton system. So, any questions there?
No.
Okay, let's move on. Functions of the bone, I already explained to you earlier. Most important, rigid framework, supports muscles, tendons, provides a structure to our body. It protects our internal organ, attachments for muscles. It's a storehouse for our bone marrow and red blood vessels, red blood cells, and it also stores calcium and phosphorus, so all the minerals, very important. Before we move on to the joints, I actually just wanted to also tell you some more about the shape of the bones. So the bones, or the classification of the bones. The bones are actually classified based on few factors. One is the shape of the bone, the developmental classification. There is some structural classification, and there is some regional classifications. So coming to the shape, in terms of the shapes, there are different shapes that it's classified as. So there's long bones, there is short bones, there are some flat bones, you know, there's irregular bones. Irregular bones are in the neck here. There is pneumoid bones, which are actually the maxilla over here, and then there is sesamoid bones, There are accessory bones. So these are all the types of bones which we can actually go into details later, but that's the classification of the bones based on the shape. Then coming to the developmental classification, there's membranous bones, there's cartilaginous, and there's membrocartilaginous bones. So that's based on the developmental. Based on the structural classification, there is actually macroscopic and microscopic. So structure would be like, spongy bone, compact bone are those classifications. That's the type classification of the bones. Coming to the residual classification of the bone, it's actually axial and appendicular. We studied that before. I told you all in the before slide, axial and appendicular bone classification of the bone. Now let's go to the different types of joints. Any questions with the bones or understanding the human skeleton system in general? Okay, thank you. It's very important for us to know the names of the bones, in order to be able to help our patients and assist them and refer them to the bone specialist if needed, which bone is affected. All that is very important to understand the names and the types of bones. Different types of joints. There are actually 3 types of joints. So let's see, what are they? Immovable or fixed joints. Immovable or fixed joints are actually also called as fibrous joints. Why they're called fibrous joints? Let's go back here. Especially the bones in the skull. So if you see, they are actually fused together. Several bones are fused together and they form a kind of a suture. So this suture is actually very tightly fused together by in the form of fiber. So this is called as immovable or fixed joints. Another important thing I wanted to mention is if this was very rigid, and very tight, then any blow to the skull would cause a crack right away. So what there is, even though it's called as an immovable or fixed joint, there is still slight movement, I would say not movement, but the expansion that happens for the soft tissues inside the brain. So what happens is that if there's a slight blow to the head, then the expansion will provide us a shock absorption. It will absorb the shock, and then there will be less chances of our skull getting fractured. So this is our immovable joint. The next one is the slightly movable joints. These joints are the vertebrae. These are the spine. In the spine, these are the joints that are slightly movable. These are also called as cartilaginous joints because there is a cartilage or a cushion that actually provides slight movement. So if you see with the spine, and in the spine, these vertebrae, we can bend forward, we can bend backwards, and then we can rotate around our back. So these are slight movements. If we go overstretch, then there are chances of some injuries, or so there's slight movements that this allows. The next type of joint is the movable joint. Movable joint is also called as synovial joint. Very important joint. It provides the movements to our body. The synovial joints, there are actually, I'll tell you how many types of the synovial joints are with our next slide. Going little detail into the fixed or immovable joints. So there are about fewer than 10 immovable joints. in our body. And as I mentioned to you, these are also called as fibrous joints because the bones are held together tightly with the fibers, with the tough fibers. So if you see these sutures again, you know, right there, these sutures, they're fused together, several bones, and they're held together by a tough fiber. Going on to our next here, let's go further. Immovable joints, as I already told you, this is also found in the pelvis here. These are immovable joints, and they're fused together to form a rigid structure. So not much there with the fixed or immovable joints, as there are only 10 immovable joints in our body. Slightly movable joints. The slightly movable joints are also called as cartilaginous joints, as we saw in our previous slide here. Let's go back. So slightly movable joints. These are also called as cartilaginous joints. So these are the vertebrae here. So let's go down to next slide here. The bones, these bones are actually separated by the cushion here. If you see, these are the cushion, this is the cartilage. It's actually also called as a shock absorbent. It's a very good shock absorbent part of our body in the joints, and it's in between the vertebrae and the spine. As you see, this is the spine, and these are the vertebrae. It's in between here. Those are the slightly movable joints. These are also held together, if you see, by a ligament that provides like slight movement. So it holds the bone in place and provides a very little movement because of these ligaments as well. And it doesn't allow us to bend. It allows us to bend forward, bend backward. So slightly movable joints, as I told you, these are also called as cartilaginous joints. They move a little bit. These are these joints are between the vertebrae in the spine. So you can bend forward, bend backward, rotate a little, but you can't like really overstretch with this one. The next one is the freely movable or the synovial joints. 90% of the joints in our body are actually synovial joints. They are freely movable. The main characteristic of these joints are that they have a synovial fluid. So if you look here, this is the purple color in this diagram. This is actually the knee. So it's showing you this is the synovial fluid. The synovial fluid is protected by the synovial membrane, which is our structure here in the diagram, the one colored in green. Synovial fluid is very important. It provides lubrication to the joints. Very important. This is then protected by the cartilage, which is the cushion. So as you know, when people, they get older, the cartilage, the synovial fluid leaks, maybe also in the sports people due to some injuries to the knee. The synovial fluid leaks. It's not a good thing to have that. It's very painful to have a synovial fluid leak. This synovial fluid is also called as the oil of the joints. So very important, 90% of our joints in the body are synovial joints or freely movable joints. All these moving parts are also held together by the ligaments. Next one, synovial joints are found in the shoulder, in the knee and shoulder. That's some examples of the synovial joints. The structure of the bone or the structure of the joint as per se, this is the bone. Then we have the joint capsule. So the top bone, the bottom bone, and in between the two bones is the synovial membrane, the cartilage, and the synovial fluid. So that's the structure of the joint. And after the structure of the joints, there's 3 types of connective tissues. Important, very important. The connective tissues are tendons, there's ligaments, and there's cartilage. These are the 3 connective tissues. Tendons, what they do is they connect the muscles to the bone. The ligaments are actually elastic fiber between the bones. Like it connects one bone to the other, but it's like an elastic fiber. Sometimes you may have heard that with the sports people, when they stretch it too much, overstretch it, or they twist and turn too much, they can have a ligament tear. Those are the elastic fibers because it's very elastic. So once it loses, it's like, it tears. It's overstretched, it tears. The next connective tissue is the cartilage. It prevents the ends of the bones from rubbing together. Cushion, shock absorption, when these actually, with wear and tear, with age, when the cartilage is actually completely gone, especially in the knee, you must have heard people go for TKR, TKR, total knee replacement, because when the bones, they start rubbing against each other, it's very painful. There's no cartilage in between, there's no synovial fluid, no membrane, so it's like rubbing against each other. Very hard, very, very painful. Arthritis happens because of that as well. When the joint spaces, they become less because of losing this cartilage, there's arthritis that comes in. We will go into detail a little bit about the synovial joints because, as I told you, that 90% of our body is made up of synovial joints. 90% of the joints in our body are synovial joints. So the type of the joints, I have not named them here, but I can actually tell you the names. This is our hinge joint. This is our pivot. This is the ball and socket joint. This is the condyloid joint. I've also seen this called as the ellipsoid joint. This is the saddle joint, and this is the plain joint. Very plain in name, but still important. Also called as gliding joint. So these are the 6 types of synovial joints. So let's go read a little bit detail into each one of those. Hinge joint. The hinge joint is a very simple joint. It provides a rotation or movement only in one axis. If you see the hinge joint in our body, as the name suggests, it only allows forward and backward. So here, this is our arm, and the elbow joint is the hinge joint. So you can only go flex and you can extend, so that's the hinge joint right here. The elbow, it's also called as a radio-ulnar joint. If you see this one, the radius is actually joint with the ulnar bone. So radius, ulnar, joint here, radio-ulnar joint. It's the hinge joint. And it's a very simple joint. So the next one is so it's just showing you the elbow. I actually already demonstrated that to you. The next one is the pivot joint. The pivot joint is also in one axis only. It rotates only in one axis. It doesn't allow a lot of movement there. So, this is a hinge joint here, but sometimes you may wonder, how do we, like in the forearm, how do we twist it? So this forearm twisting over here is the pivot joint. It also allows for the protrusion around which it can rotate. So this is like this, it can rotate. So this is our pivot joint right here. So this is the distal part of the radius and the ulna, and this is our pivot joint. These joints, as I mentioned to you, only allows rotation because it's only on one axis that it rotates. Another example of the pivot joint is actually the neck joint. You know, you can't do all type of movements with that. It's only rotation. Ball and socket joint, very important joint. The ball and socket joint, it is our champion of the joints. It's also called as a champion of the joints, and it's exactly the way it sounds. So the shape of this joint is exactly the way it sounds. It's a ball inside of a socket. It allows for lots of movements. It allows for our rotation. You know, this shoulder joint, the hip joint. These are ball and socket joint. If you see this shoulder joint, that the socket, so this is the ball and that's the socket. The socket is not actually very deep. Whereas when we actually go to our hip joint, the socket here is very deep. So what it does is, you may have seen that a lot of people, they suffer from shoulder dislocation. So this like really dislocates downwards because the socket is not very deep. Whereas for our hip joint, it's a very deep socket. So it allows movement in a lot of directions. So the next, it's one of the most mobile joint in our body. As I mentioned, the examples are shoulder and hip joint. The condyloid joints. The condyloid joints, these are, as the name sounds, these are like a concave and the convex part. So the concave and the convex part, they're joined together right here. You see, these are, they fit, the ends, they fit into the corresponding bone. The condyloid joint, the example of the condyloid joint is actually, this particular joint allows the movement forward, backward, left, and right. So it doesn't allow rotation. There's no rotation with the condyloid joint. Examples, these are between the metacarpals and phalanges. So right here, these are the joints, the condyloid joints, between the metacarpals and the phalanges. So the condyloid joints in the hand. Saddle joint. The saddle joint, it's like a shape of a saddle. The two bones, they fit together in a special way, you know, allowing moving forward, backward, and left and right, but again, no rotation. There's no rotation with the saddle joint. If you see this picture right here, this is our metacarpal bone in the thumb that allows for, that's a saddle joint. Next joint is the gliding joint or the plane joint. As I mentioned to you, it's a very plain joint, but it is still important. It allows a tiny bit of movement in all directions. So forward, backward, you know, front, and so it allows in all directions. It's a flat surface. It's a flat bone, so that's why it's called as a plane joint, and it glides in all directions, forward, backward, lateral, you know, centrally. So that's why it's called as a gliding joint. The examples are actually in the ankles here, the tarsals are the saddle joint. With the joints, it's important to understand the movements of the joints. They allow various movements. So when we were reading, studying about this synovial joint and the ball and socket joint, ball and socket, the the hinge joint, the pivot joint, you know, what they allow, what type of movements they allow. It's very important to understand that. So let's go and look at that now. Movements. The movements are, there's different types of movements with these joints. Most important are the flexion, there's extension, adduction, and abduction. Flexion, let me just demonstrate that. So flexion is right here, it happens here. Flexion, you know, and extension. Even with the leg, you can go flexion and extension. So in this one, the flexion, when the angle of the joint decreases. So this is the angle of the joint decreases. Extension is that the angle of the joint increases. That's flexion and extension. Next one is the adduction and abduction. So adduction, as it sounds, the name, easiest way to remember it, adding to the body, adduction. So in that way, you're going actually adduction like this inside. So this is the leg, and you're doing it like this is adduction. When you actually do some exercises, you know, you go this way to make it, you know. So it's adduction and abduction. So adduction is movements toward the midline of the body is adduction. The movement away from the midline of the body is abduction. So these are the different movements allowed by the joints. Circumduction. Circumduction, the ball and socket joint, very important. It allows direct movement in all directions. You know, the circumduction, you can go like this, exercise. If you look in this picture, there's rotation. So rotation in all directions is actually circumduction. For sports people, you know, in India we play cricket a lot. It's very common here now too, and in Canada, baseball, golf, everybody, like it's a full body movement. It's the rotation. So in this one, the limbs move in circular motion towards the midline of the body. For example, this occurs in the golf swing. So right here, it moves like that, full rotation. So there's different type of rotations as well. If you want to go into detail, we can actually, we will in the next class. So there's medial rotation, there's lateral rotation, so different types of rotations with the circumduction. Okay, and I believe that's it for the day. Any questions you may have, you may want to ask me, and I'll actually give you one small assignment as well. So any questions you have? No questions? All clear? That's good. In terms of the assignment, I would actually suggest you guys, when you go home, to write some stuff about ball and socket joints, what type of movement it does, maybe draw as well the ball and socket joint and bring it back to the next class. Thank you.